my chain. Cardi B straight stunning, can't tell me nothing. Bossed up and I changed the game. It's my big bronze boogie, got all them girls shook. My big fat ass got all them boys cooked. We're from dollar bills, now we popping rubber bands. Bruno sang to me while I do my money dance like, hey. Flexing on the gram like, hey. Hit the Lil Jon, okay, okay. Oh yeah, we dripping the finesse and getting paid.
Ooh, don't we look good together? There's a reason why they watch all night long. All night long. Woo. Yeah, I know we'll turn heads forever. So tonight I'm gonna show you off. When I walk with you, I watch the whole room change. Baby, that's what you do. No, my baby don't play. Blame it on my confidence. I'm blaming on your measurements. Shut the shit down on sight. That's right. We out here dripping in finesse. It don't make no sense. Out here dripping in finesse. You know it, you know. We out here dripping in finesse. It don't make no sense. Out here dripping in finesse. You know it, you know it. Now slow it down for me, baby. 'Cause I love the way it feels when we grind. Yeah. Our connection's so magnetic on the floor. Nothing can stop us tonight. When I'm walking with you, I watch the whole room change. Baby, that's what you do. No, my baby don't play. Blame it on my confidence. I'm blaming on your measurements. Shut the shit down on sight. That's right. We out here dripping in finesse. It don't make no sense. Out here dripping in finesse. You know it, you know. Out here dripping in finesse. It don't make no sense. Out here dripping in finesse. You know it, you know it. Fellas, grab your ladies if your lady fine. Tell her she the one for life. Ladies, grab your fellas and let's do this right. Do this right. Like me and mine.
Yeah, we got it going on, got it going on. Don't it feel so good to be us? Yeah, we got it going on, got it going on. Yeah,
Girl, we got it going
yeah, we got
on.
it going on, got it going on. Don't it feel so good to be us? Yeah, we got it going on, got it going on.
Dripping in finesse. It don't make no sense. Out here dripping in finesse. You know it, you know. Dripping in finesse with my baby. Oh, dripping in finesse. You know it. Girl, you know we got it going
Yeah, we
on.
got it going on, got it going on. Don't it feel so good to be us? Yeah, we got it going on, got it going on. Yeah, we got it going on, got it going on.
Don't it feel so good to be us,
Yeah,
baby?
we got it going on, got it going on.
And now we go on to the discussions of the muscles of the lower limbs. Now, where are the muscles of the anterior leg? The muscles of the anterior leg are located within the anterior compartment of the leg. Now, when observed, this is seen as the anterolateral region of the leg. Because of the nature of the origin, insertion, and their movements, these muscles are also known as the dorsiflexors of the leg. The muscles found in the anterior compartment of the leg are the extensor digitorum longus, extensor hallucis longus, tibialis anterior, sartorius, pectineus, adductor longus, vastus lateralis, and vastus medialis.
The extensor digitorum longus muscle. So first, let's define what is this muscle. It is a muscle or a pennant muscle located or situated laterally in the legs or in front of the legs. So it is a long, thin muscle that runs down in front of the shin and across the ankle joint and into the toes. So let's start first to the origin of this muscle. The origin of this muscle is the anterior surface of the shaft of the fibula. Next, the insertion, the extensor expansion of the lateral foretoes. And for its nerve supply, it is the deep peroneal nerve. petex, the nerve root, it is the L5 and also the S1. And for the action or movement of this muscle, it extends toes and also it extends the foot at the ankle joint. That you can see this on this video.
Don't we look good together? There's a reason why they watch all night long.
This muscle is what you call the extensor hallucis longus. This video will show you how this muscle works.
Don't we look good together?
It extends the big toe, it extends the foot at ankle joint, it inverts the foot at subtalar joint and transverse tarsal joints. Origin: the anterior surface of the shaft of the fibula. Insertion: base of the phalanx of the great toe. Nerve supply: the deep peroneal nerve, and the nerve root from L5 to S1.
The tibialis anterior muscle. So this muscle is the most anterior and medial of all four anterior leg muscles, and it originates from the proximal portion of the leg, precisely from the lateral tibial condyle and the proximal half of the tibial shaft, in addition to the adjacent portion of the interosseous membrane. While in the distal portion of the leg, the muscle fibers converge to form a tendon that extends through the medial side of the foot toward the muscle's insertion, which consists of the medial cuneiform bone and base of the first metatarsal bone. So the main function of this muscle is to dorsiflex the foot as well as inverting it. It also supports the medial longitudinal arc of the foot, and the blood supply of the tibialis anterior muscle comes primarily from the anterior tibial artery and its branches. And finally, it is innervated by the deep peroneal nerve. So the deep peroneal nerve is a branch of the common peroneal nerve, and it acts as both an antagonist and a synergist of the tibialis posterior. So in the dance video that we've made, whenever we would lift our feet, that is when the dorsiflexion action is being done, basically. The tibialis anterior muscle's action is dorsiflexion, and it can be seen whenever we lift our legs. And it is seen in our video during these parts.
Grab your ladies if your lady fine. Tell her she don't want for life.
The iliacus muscle. Now, the iliacus muscle isn't really found in the anterior compartment of the lower limbs, but rather it is a triangular shaped muscle located in front of the hips. Specifically, this muscle originates from the iliac fossa of the ilium or the hip bone. The iliac fossa is the large, concave portion of the hip bone, and from the iliac fossa, the iliacus muscle travels down in front of the hips and joins the psoas major muscle to create the iliopsoas muscle. Specifically, the iliacus muscle functions to flex the upper leg. Now, what is flexion? Flexion of the upper leg involves moving the upper leg forward, such as when walking, jogging, or jumping, or marching. This can be seen in this part of the video.
The psoas major is a spindle-shaped muscle that can be found on the side of the lumbar region at the vertebral column. It assists with the flexion and external rotation of the hip joint. This was shown in this dance move. One of the origins would be transverse processes. The insertion is lesser trochanter of the femur. The nerve roots would be L1, L2, and L3. And the nerve supply is the lumbar plexus.
As you have seen from the dance, the rectus femoris muscle is one of our four quadricep muscles. It is located in the middle of the front of the thigh. It is responsible for the knee extension and hip and thigh flexion, as you have seen from the dance, of course, like the dance. You can see the action from the dance.
Bossed up and I changed the game. It's my big bronze boogie got all them girls shook. My big fat ass.
And it is the main muscle that can flex the hip. The rectus femoris is attaches from the pelvis to just below the knee. The another muscles for the quadriceps include the vastus medialis, vastus intermedius, and the vastus lateralis. Also, the rectus femoris muscle has two heads. The straight head has its origin on the anterior inferior iliac spine, and that is reflected head has its origin of the ilium, above the acetabulum. It has the insertion into the patellar tendon at the patella of the knee. It is fed up by the descending branch of the lateral femoral circumflex artery.
So the pectineus muscle. The pectineus muscle is part of the medial compartment of the thigh. It is a flat quadrangular muscle situated at the anterior, upper, and medial portion of the thigh. This muscle is the most anterior adductor of the hip, and this muscle thus adducts and medially rotates the thigh. To learn more about the function of this muscle, let's watch this video.
Cause I love the way it feels when we cry.
The origin of this muscle is the pectineal line of the pubic bone. Insertion would be the pectineal line of femur. Arterial supply is the obturator artery, and finally the nerve supply is the femoral nerve.
Hi, so my muscle is adductor longus, and its origin is at the body of pubis and at medial to pubic tubercle. Its insertion is at the posterior surface of shaft or femur, specifically at the linea aspera. The nerve supply of this muscle is the obturator nerve, and its nerve root is at L2, L3, and L4. Its action is that it adducts the thigh at the hip joint and assists in lateral rotation. So, as you can see in the video, any movement that involves the thigh moving towards the midline of the body at the hip joint, that involves the muscle adductor longus, and it assists in lateral rotation.
An example of this muscle's movement is this dance move.
Cause I love the way it feels when we cry.
The move where the thigh abducts, so it goes lateral or away from the midline. It also assists in that because we have muscles that are antagonists and protagonists in action. So those are the two actions of the adductor longus.
It forms the medial wall of the femoral triangle, and it lies anterior to the adductor magnus.
The sartorius muscle is a thin, long, superficial muscle in the anterior compartment of the thigh. It runs down the length of the thigh and over two joints, the knee and hip joint, and is the longest muscle in the body. Its origin is at the anterior superior iliac spine, and its insertion is at the upper medial surface of the shaft of the tibia. It is supplied by the femoral nerve, and its nerve roots are at L2 and L3. The muscle receives 5 to 11 vessels originating from the superficial circumflex iliac, lateral femoral, deep femoral, descending geniculate, and femoral arteries. Lastly, it flexes, abducts, and laterally rotates the thigh at the hip joint, and it also flexes and medially rotates the leg at the knee joint as seen in this video.
The vastus lateralis muscle is part of the quadriceps muscle alongside with the rectus femoris, vastus intermedialis, and vastus medialis. Now, on a collective note, the quadriceps muscle is actually the largest muscle in the human body, and its function is for the extension of the knee. But on a specific note, your vastus lateralis is responsible for the extension of the lower leg, and it helps the body arise from a squatting position. Its points of origin and attachment is actually the linea aspera of the femur for its origin, and its attachments are the quadriceps tendon of the patella and the tibial tuberosity of the patellar ligament. Now, its innervation is actually the femoral nerve from L2, L3, and L4. and its arterial supply is the lateral circumflex femoral artery. Now, one thing about the vastus lateralis muscle is it is important to warm up before exercising because there is a possibility of a tearing in the muscle if it is not properly warmed up. This muscle's action can be seen on this part of the dance.
You know, dripping in finesse with my baby.
Vastus medialis. Now, the vastus medialis is part of the quadricep muscle group, which is found in front of the thigh. It is the most medial or inner of the four muscles making up the quadriceps femoris. The vastus medialis extends the entire length of the thigh, and it is also located above the kneecap. Its action is knee extension, and when extending your knee, the muscle can be felt and sometimes you can see the muscle contract. The function of the vastus medialis is that it helps to stabilize the kneecap and keep it in line when bending your knees. Having strong vastus medialis muscles can help you prevent any kind of knee injury. The origin of the vastus medialis is the inferior portion of the intertrochanteric line, the spiral line, the medial lip of the linea alba, superior part of the medial supercondylar ridge of the femur, and the medial intermuscular septum. Its insertion is the medial base and border of the patella, and it forms the medial patellar retinaculum and medial side of the quadriceps femoris tendon. Its innervation includes the muscular branches of the femoral nerve, and its arterial supply is the femoral artery, the profunda femoris artery, and the superior medial genicular branch of the popliteal artery. This muscle's action can be seen in this part of the video.
Bossed up and I changed the game. Just give it. It's my big bronze boogie got all them girls shook. My big fat ass got all them boys cooked.
The adductor hallucis muscle arises by two heads, the oblique and the transverse heads. There are two origins for this muscle. The transverse head, which is from the ligaments associated with the metatarsal joints of the lateral three toes, and the oblique head, which is from the base of the second to the fourth metatarsals and the sheath covering the fibularis longus. Its insertion is the lateral side of the base of the proximal phalanx of the great toe. The arterial supply for this muscle is the lateral plantar artery, and its innervation is from the lateral plantar nerve from the tibial nerve. The action of this muscle is the adduction of the great toe at the metatarsal phalangeal joint. The action of this muscle can be seen at this point of the dance.
Now slow it down for me, baby. 'Cause I love
the flexor digiti minimi brevis muscle of the foot lies under the fifth metatarsal bone. Its origin is at the base of the fifth metatarsal and the related sheath of the fibularis longus tendon. Its insertion is at the lateral side of the base of the proximal phalanx of the fifth toe. Its arterial supply is the lateral plantar artery. Its innervation is the lateral plantar nerve from the tibial nerve. Its action flexes the fifth toe at the metatarsal phalangeal joint, which means it is involved with walking and balance. The action of this muscle can be seen at this part of the video.
you. I watch the whole world change. Baby, that's what you do. No, my baby don't play.
The flexor hallucis brevis muscle is one of the small muscles found in the foot that is involved with the inversion of the first toe. Its origin is from the plantar surface of the cuboid, and its insertion is from the medial and lateral sesamoid bones of the first metatarsals. Its arterial supply is the medial lateral artery, and its innervation is from the medial lateral nerve. The action of this muscle is the flexion of the first toe. The action of this muscle can be seen in this part of the dance.
Now slow it